practice of myofascial release, of essentially moving energy through our fascia. Our fascia is the kind of soft skeleton that wraps all around our bones, and energy, chi, travels through our fascia. And we'll see if we can just find little knots of myofascial tension, knots where our energy is not flowing, where our body's messages are getting stuck or maybe not flowing where we want them to. So it's a simple practice, and we need a ball or something. Some people have onions or lemons, whatever you have. You can also, if you like, have 2 balls in a sock, which I really like, especially for the spine, rolling along the spine. So you're not kind of favoring one side or the other. You're doing both sides at the same time. But whatever you have, work with it. Always improvise, always just work with whatever you have. Best practice is the one that you can do anywhere, anytime. So let's just start by bringing our attention into the body. You might like to take a big sigh. Just let the shoulders be heavy. You might tuck in your chin a little. So allow yourself to be here. Let's bring our arms down by the side. We'll take a breath to lift up, reaching high. And then as we sigh out, sinking down. Just finding the flow of our breath. Lifting, breathing in. And sighing out, letting go. And one more time. Okay, let's come down onto our spine. I should mention too, if you have a book or a block or something, just to elevate your head a little, you might want to grab that. And I'm going to lie down on our spine. And we'll take our first ball and place it right in the center of the neck. So right underneath your occipital bones. It's just a natural place in the middle of your neck that you can find a release. Now, you might just like to let your head be heavy. Take a few breaths in. Just notice any tension here. So those occipital bones, there's 2 big bones right at the base of your skull. And let's take this ball out. We're going to just find one side. Just find that natural kind of indent right underneath the bone. And we'll place the ball underneath that. Just let our head be heavy again. Sigh it out. Give yourself a few breaths in each shape. So the Chinese medicine name for this spot is Feng Shi, or wind pool. It's number 20 on our gallbladder meridian. Place where we hold a lot of tightness, a lot of tension. Let your head be heavy, sigh out. And then we'll slowly lift up. You might turn the neck to the other side, find that same spot just underneath the occipital bone, turn the head, and then just let the head be heavy. Okay, if you have had the block in, you might like to take it out. Same places, but this time we're going to start in the middle of the neck. And we're just going to slowly turn the neck to the side. And then slowly to the other side. Let your head be heavy. Tuck in your chin if you can. Don't want to lean the head back too far. Just notice the feeling. If you find the ball is going to pop out, you might need to hold it in there with your hand. Just turning our neck side to side. If you find any specific spot where you feel particularly tight or tense, you might just stop there and just hold that spot for a little bit. You'll find that the muscle will release at some point, and then you might keep going. And if you have the double ball, you might like to try that. Right. Taking it right underneath each Feng Shi point. And then just turning the neck side to side with the support of the balls on either side. All right. Let's take those balls out. Keep your head heavy. We're going to come down all the way to the other end of our body, or the mid part of our body, our glute muscles. So our glutes are the biggest muscle on our whole body. And you might like to just drop your knees down one side and then the other. Keep your tailbone heavy. So we're not trying to twist our spine. So our spine is flat, our tailbone is heavy. Just let your knees open out. Just get a sense for your range of movement. We'll take our ball and just roll it under one butt cheek. Now, if you want to orientate yourself, you might find your ASIS, that's that big bone that juts out at the side of your hip, a little higher. And then at the top of your leg, where your femur bone connects to your pelvic bone, this is your greater trochanter. So that's that bone that sticks out the side of the body. And then, of course, you have your sit bones. We all know where they are. You might find them. So we'll see if we can orientate our body a little bit here. So base of the tailbone, the ASIS, the greater trochanter at the top of the leg, and then the sit bone. And I know it can be tricky to see on the screen, so just get a sense of where all these things connect in your own body. So we're going to roll the ball right up close to the base of the tailbone, and it's going to be inside and under the ASIS, and just in from the greater trochanter, the one where your femur bone connects. And if all that sounds like a lot of gobbledygook, that's okay too. Now you might like to lift the spine off the ground and just let the ball find its spot. You might roll around, and we're just moving between all those key points in the body. So you might move a little closer to the tailbone, you might roll down towards the sit bone, you might roll out to the top of the leg bone. Just explore. Body is heavy, and we're looking for those knots of muscle tension. So instead of trying to avoid those knots, those bits where we feel tender, just find them, seek them out, and then just let your body be heavy. You might take a breath or two. We'll stay on the same side. We're going to drop our tailbone down, take the ball out for a moment. And this time we'll do something a little bit different. We'll squish the ball under again. Just find that kind of cushy part of your butt cheek. And then this time we're going to lift our leg. And we're going to explore in a slightly different way. So you might take the knee out wide. You might extend the leg long. You might draw the knee up to the chest. Just notice if you're holding your breath or clenching your jaw. Wherever we take our attention, we give great power. So when our body is tight or tense, our energy is not flowing. When we move our attention to that part of the body, chances are we might free up and allow everything to move again. If you want to go even deeper, you might take that foot across the leg, extend the knee out, and you'll feel a strong sensation in your hip joint now, and then you might lift the tailbone again and roll again. And whenever you're ready, let's just drop that tailbone down, extend the legs out. Really good thing to do when you do ball therapy is just take a few moments to notice energy moving. So as you extend your leg out, just notice how this side of the body compares to the other side. Maybe it feels a little warmer. Maybe it feels a little longer, a little heavier. Just notice whatever sensations you have in your body. And then when you're ready, we'll swap our ball to the other side. So we'll start by lifting the tailbone, placing the ball just right in the butt cheek. Find the spot. You might like to orientate yourself in your body again, your ASIS, that big one that juts out at the waist. The anterior superior iliac spine is what it stands for. And then just notice where your leg bone meets the pelvic bone. Notice where the sit bone is. And we'll start by lifting our spine and just rolling the ball between all those points. What can we discover? What can we learn about our body? If you find a spot of tension, just stop. Big sigh. And then we'll keep going. This time we'll take the spine down. And we'll lift the leg up. Just exploring again. You might take the knee wide. Maybe even across the body. Notice any cracks or pops. And just keep exploring. Your body will tell you where to go. can always trust your body to send you messages. Might be a message of discomfort, a message of pain, but your body will always tell you what you need, where you need to put your attention. Often we ignore these messages, but today we might just see what we can notice. Just like we did on the other side, you might like to take your foot across, extend the knee wider, lift the tailbone, roll the ball, a little bit more intense maybe. And whenever you feel ready, just drop back down, extend both legs out, just like we did. Notice how you feel now, maybe a little more balanced. You might like to gently rock side to side. Let's draw both knees in and just hug the arms around, maybe a little rock. And then we might take one hand on each knee and just open through the hips. Spine stays long. All right, we're going to come back up the body now to the rhomboids. Now, if you have your double ball, this is where it comes in handy. The rhomboids are muscles that run either side of your spine. If you only have one ball, that's okay too. You can just do one side at a time. I'll let you know when to swap. So you might place the balls just underneath the shoulder blades, and then just let the body be heavy. Drop the head down. Take a few breaths. Now, let's see how we go here. We're going to see if we can roll the balls along the body. So you might lift up the head and just let the body be heavy, rolling them down the spine. Whenever you need to, just drop the head down and take notice of any point of tightness or tenderness. And then you might keep going. You're welcome to, of course, move the balls with your hands. Maybe find that spot. It might be a little lower in the body. There's very key acupressure points directly behind where your belly button is, either side of the spine, getting close to our adrenal glands there, close to our kidneys. But just explore, roll up and down. If you've just been on one side, you might like to swap to the other side. Sighing out, sinking down whenever you need to. You might also like to just find that spot under the shoulder blades and start to explore through the arms as well. Just take the arms above the head. Maybe even across, opening out. Okay, let's move on from the rhomboids now. We're going to do, just at the top of our shoulders is a muscle called the levator scapulae. So bring the balls to the top of the shoulders, or just one of the shoulders now. Just let your head be heavy, so your balls are right on the top of one shoulder or both. Levator scapulae is our shrug muscle, so you might roll the body down, take the shoulders right up to the ears, and then back down. Big shrug, big I don't know. If you're just doing one side, swap to the other. We might do another muscle on the outside of our shoulder, sort of behind the armpit, is one called the teres minor. This is kind of our ball throwing muscle. So just reach around from your armpit, just behind the shoulder, end of the shoulder blade. You might like to extend your arm up or out. You can hold a lot of tension here. If you like, you can lift the body up, roll onto the ball. As always, whenever you feel that tightness or tension, just stop. Big sigh. Invite the energy to flow back as soon as you move again. We always forget we can guide the flow of blood in our body, the flow of chi and energy through our fascia any time of the day. Let's go to our teres minor muscle on the other side, right on the outside of the shoulder, just behind the armpit. Keep exploring. All right, we might do one more on our shoulders. Our deltoid is the muscle on the outside of our shoulder. You might like to roll a little bit on your side, put the weight of your body just on the top and the outside of the shoulder. Roll the ball around. Big sigh. And then the deltoid on the other side. Just let your whole body be heavy. Roll forward and back. Let that energy move. All right, let's come back onto our spine. This time we're going to reach in between, maybe find our ankles or our shins. Take a happy baby. You might like to rock a little side to side. You might like to extend the legs out, take a few bicycle wheels forward or back, keeping the spine heavy. If you'd like to join me, I'm going to rock and roll to come up to sit. You're welcome just to roll over onto your side and press yourself up if you like. You might like to take a few rolls along the spine, just massaging the spine. And when we come up to sit, we're just going to bring our feet together, wrap our hands around, let our knees come out as wide as they want to. And then just a little bit of letting the body relax and extend, wide and heavy. Try and let go of your sense of control, of needing to stay upright. lean into each side. And we'll finish our practice today just in a seated position. Spine is straight. You might bring your palms onto the body. You might like to just roll your neck side to side. Maybe lift your chin. Roll your shoulders. Just notice feeling in the body. Maybe we have released something. Maybe some stress, some pressure has left our body. Let's join our palms together. On this Friday, you might just like to have a moment in gratitude for the week that has passed, all the hard work we have done. And as we always do, let's bow to each other, acknowledge shared energy of practice together.